What if the future of maternal care uses technology to tune us into the body? In this episode, I speak with Katherine Sylvester, Dr. Kat, as she's affectionately known, about her program to use wearable technology and remote monitoring to reshape maternal health by pairing objective physiologic data with relationship-centered clinical care. Instead of relying on population averages, they dive deep into the power of tracking each mother's personal baseline and monitor subtle shifts in trends to reveal early warning signs long before symptoms escalate. If you're a PT or OT working with pregnant and postpartum clients and you want to integrate data informed insight without losing the heart of your practice, then this conversation is for you. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. I am beyond excited to share this guest with everybody today. I found out what she was doing at one of my courses, and I was like, this is amazing, and I want to talk to you to find out more what's going on. So everybody, this is Katherine Sylvester is here with us today. And Katherine is a physical therapist. She's also a mom, a VBAC doula. She started Mommy Monitor and is also an assistant adjunct professor at a couple universities. And she lives in Macon, Georgia. Welcome to the podcast, Katherine. Thanks for being here.
Thank you so much. I'm so excited to be here. Thank you for having me.
Well, so tell us first off, tell us your journey, how you got to be where you are today.
Okay, so it started in honestly the ninth grade. I realized that I wanted to be part of a profession that focused on quality of life. And physical therapy just rose to the top because my grandmother, a few years previous, had had a stroke, and we were just told to let her lay in the bed, roll from side to side, make sure she's eating, sitting upright. And it was just the last 6 months of her life were not the quality that they should have been or could have been had she had different if we had different instructions. And so when I stumbled upon physical therapy, I was like, this is it. This is it. And so from then through college, I never changed my mind. And after I graduated, I started working with people with neurological injuries, brain injuries, spinal cord injuries, stroke, kids. Loved being in the hospital. It was the best thing. But at that time, I also realized that I gravitated towards working with women. And so anytime we split the list, it was never half top, half bottom. It was give me the girls and you can take everybody else. And so
Yeah.
I just learned that I love working with women. And it was after my first birth. I had my son at home. It was an incredible journey experience. But a year later, there were four women who reached out to me. One was peeing on herself, one had pain with intercourse, one was having issues with her scar. I mean, things that, and
Yep.
that would have been prevented had a physical therapist been on her journey. So I started a program at that time called Rediscover Your Music. Music is an acronym for muscle flexibility, urinary continence, sexual fulfillment, internal confidence, and core stability, and
Oh,
started
wow.
looking at them through the lens of how they eat, how they move, how they sleep, how they manage stress, and realized that a lot of women didn't have to run into these problems, right? And we also sent them at that time a Fitbit and created a program for them, and then was able to see how their body, how they responded to the programs that we developed. And then we would course correct along the way. So that started my intro into loving to use technology to enable care. And that was back in 2014. So flash forward to my second birth, and it was just another wonderful experience, home birth again. But at the very end of my pregnancy, I started feeling contractions like I did with my first, but they didn't progress. And although that's not in and of itself a problem, I felt like something might be wrong. So I reached out to my midwife, and she said, "Oh, well, come on in. I'll take a look at you." She took my blood pressure. My blood pressure was 128 over 78. And she looked shocked. She was like, Catherine, what's going on? And I said, oh, nothing that I know of. And she said,
Yeah.
well, have you been swelling? And I said, well, yeah, I'm a PT. So we're all wrapping, compressing, making sure I can still wear my heels for the rest of my pregnancy. So kind of overriding the swelling, right? That she
Ah,
would have otherwise been able to see. And then so she said, do you have any stress? And I said, no, I don't feel stressed. So she went ahead and checked me for preeclampsia because my baseline blood pressure is 100 over 60. And when she checked,
I was
I
gonna
was
say because 120 over 78 isn't that big of a deal, right? Like that's some
right.
people's normal.
That is some people's normal. And because it wasn't my normal, she delved deeper. Apparently I was spilling protein into my urine. My labs were already off. And so
Oh,
because she caught it that early, I was still able to deliver at home. After I delivered, she said, Catherine, you should really just relax. Your body, you never know what's going to happen postpartum. And for me, that meant not waking up so early, not going to bed so late, but I still had a younger child to take
yeah.
care of, still had, things to do. My husband's here, but he travels. And so I didn't really do what she asked me to do, even though I thought I was, if that made sense. I
Ah,
wasn't
yeah.
relaxing enough. And so within the next week, my blood pressure was through the roof in the 160s over 105. I was in and out of the emergency room. Oh, yeah, it was a nightmare. And
Oh,
she was just right that I needed to just relax, but I didn't have an objective way to know how to do that. So Perry Brubaker sent me a watch and she was like, hey, she's also a physical therapist. She's incredible. Sent me a watch and she was like, hey, we're using wearables to detect COVID. Do you mind putting on this watch? And I said, oh, no problem. And so put the watch on and it just changed my life. I was able to see exactly how much was too much, right? Within 2 weeks, I was off my blood pressure medication. Within 9 months, my kidneys had completely healed because I actually was close to nephrotic syndrome by the time, yeah, afterwards, after I didn't relax. 9 months later, kidneys were healed, and I thought every woman needs this. So I wrote for a grant and sent 40 watches all over the nation just to monitor, see, could we in fact help people not only recover better following delivery, like slow down like I wasn't able to, but
yeah.
also to see could we stop them from running into issues? Could we teach them how to prep for pregnancy? So instead of waiting for pregnancy to happen, can we see where they are at baseline and then help them show up healthier? And after the first one, the answer was yes, but we still went through with the initial 40 for free and just monitor them to see what we could do. And so here we are 5 years later, almost 5 years later. We started in 2021, so
Yeah.
almost 5 years later.
Oh my God, this isn't crazy. Okay, so you have to help me out here because I am not a wearable person. I don't like anything on me. I don't wear a watch. So tell me what is the data that we're getting on these Fitbits?
Yeah, so well now we use Garmin's. So I swapped to Garmin's
Okay.
and we're getting heart rate, oxygen,
Yeah.
sleep hours, sleep quality, stress. So they use HRV and do a stress number so that a regular person can understand it.
Yeah.
And then we also though send them devices. So blood pressure cuffs,
Okay.
thermometers, pulse oximeters, because we know, as you know, technology is not always
Right.
reliable or it
Yeah.
doesn't always catch everything. The battery could die. And so we need to
Yeah.
still be able to monitor vital signs, even
Right.
if the watch isn't there. And then we also do surveys and make sure that we're not missing anything. So they fill out surveys, are the
Huh?
mommies that we support,
Yeah.
so that we can see, technology is good, but knowing exactly what's going on and being able to make better sense of your data makes more sense than just thinking that the watch will pick up on everything. But yes, those are the things that the watch specifically tracks.
Oh, this is blowing my mind.
Yeah,
I
yeah.
love
And one
this.
more thing that you'll
Yeah.
love. It's called a body battery. So you remember when I said I knew exactly how what I was doing was impacting me?
Yeah.
The body battery is like a phone battery or like a gas tank. And so if you're at 100%, then you kind of know, oh, I could do pretty much anything I want to do today. But if you wake up and you're at a 5%, then you have to make a decision. And that's what we teach our moms. Are we going to do what's on our to-do list, delegate, delete, or delay? And so we're making that decision, right? Using that decision process
Yeah.
to honor what our bodies are asking of us. And so the body battery is my favorite feature, hands down. Some of the other watches will do like an energy score and things like that. But I kind of like the battery so that throughout the day you can double check. You might have woken up at 100, but if you're at 20 by noon,
Yeah.
you still need to modify the rest of your day.
Oh my gosh. It's so interesting that we need this because actually all of this could be done by our interoception of our body. Like if we actually listened to our bodies, right, Catherine? I'm like,
Please.
okay,
Yes.
but today's world, we are so disconnected from our bodies and so distracted. And everybody loves the technology. We love our phones, we love our watches, we love closing those rings on those Apple Watches. My sister's huge in that. And I'm just like, I'm not going to be yeah, anyway, that's my resistance to technology a little bit. But oh my goodness, this is incredible.
Thank
So so many questions and where I want to go here with this, but what are some of the things that you are monitoring or what let's go here first. Sorry. What are the things that are so important for us as practitioners to be looking for in our postpartum clients? Okay, let's start there first.
Yeah, so we're looking for, there are five major causes of maternal death. And the cool thing is that all of them can be picked up on with vital signs, right? So, one thing we should be looking for is hemorrhage. So, we don't know who's going to hemorrhage, but we know that there's a risk for it, right? And so,
Right.
if we see heart rate increase, because we know if we're losing blood volume, then the body has to compensate. And the initial compensation will be a heart rate spike. And so what we do is we compare people to their baselines. We never compare them to anyone else. And so that's where the mommy monitor comes in, right? It is making sure that we're not looking and saying, oh, have they reached 110 beats per minute at rest? We're saying, are they significantly higher than they have been since we've been watching them, either whether it's been pre-pregnancy, during pregnancy, or even post-delivery? And are we seeing resting heart rate or average heart rate, max heart rate go in the opposite direction than what we would expect? Because we know that if someone just finished having a baby, so when we think about what happens during pregnancy, resting heart rate is going to increase over the course of
Right.
pregnancy, right?
Yep.
So after they have the baby, the expectation is that resting heart rate will go down. And it's a pretty quick decrease. So if we see it continue to climb, that becomes a red flag. So for someone who's not watching someone over time, like us,
Yeah.
or like PTs who don't monitor data all the time,
Right.
what they're looking for is that increase in heart rate that you would not expect. So let's say that someone goes from sitting down to standing up. You don't expect that their heart rate will go from 70 to 120.
Right. Yeah.
Really, it's a significant increase. So then you start to look for the other symptoms that you would see, like someone may be getting dizzy or they're short of breath or they're having a hard time, completing activities. And then also asking about bleeding. So we
Yeah.
expect that blood is going to get lighter as moms progress, but
Yeah.
if it continues to increase or they notice that it's bright red for 15 days, you know what I mean? Like
Yeah.
you're asking now about what has your history been? Because when I used to go into women's homes, it was within the first week following delivery. So I'm already asking, has your blood gotten lighter? Do you feel tired when you're moving around? Things like that. But heart rate and then oxygen. So we know that if the body is not able to compensate, then oxygen levels are going to drop. So if someone's not 90 or above, just like we would typically expect, or
Yeah.
around 100%, then that would be a red flag. And for us, we're watching SATs overnight and during the day. And so we're looking for, does this person decrease significantly than where they were before? Not necessarily waiting until they get really low
Yeah.
to do that. So that's hemorrhage. So then we're also thinking about postpartum preeclampsia, like me. And so we're looking at blood pressure changes that are relative to the person's norm. So we're not looking and waiting for it to get to 140 over 90. That's what standards say, or
Yeah.
160 over 110 before it's completely an emergency. We're looking to see, is their blood pressure significantly higher than it was before? And then also pairing that with, do they have a headache? Is their swelling significantly higher? Because we expect that it's going to go down after delivery. Now, one thing that we found is that when people receive a lot of fluids, during delivery, maybe over the course of days, they are definitely going to be at a higher risk for blood pressure issues to arise. So we know research tells us that blood pressure is supposed to go up, or not supposed to. Blood pressure will typically go up between days 3 and day 6 post delivery. But what we find is that if someone is relaxing, they're taking, not, they're not doing a
Yeah.
lot after delivery, they're making sure to continue to hydrate well, they're making healthy eating choices, their blood pressure may go up a little bit, but then it's going to come back down. But the way the blood pressure management system works for the first 2 weeks is that if it gets too high up, the body already has a hard time bringing it back down. And that's no matter what. It's just after a birth. But when we think about the higher risk that someone's at if they've had a cesarean delivery, if they've received a lot of fluids following or during their delivery, if they were on bed rest for any period of time, or they had a length of stay within the hospital, so they weren't really moving around as much as they normally would, then we automatically categorize them within our program as high risk, right? So we don't have to wait for someone to say that they're high risk. We just need to ask about what was your labor process like? And that way we can be on the lookout for a blood pressure spike. So again, blood pressure spike, increase in swelling or pain in the upper right quadrant of the torso, because that's where the liver sits, right?
Yeah.
And so just looking for those signs as well. So we're pairing the numbers with the signs and symptoms that we're seeing, just as we normally would.
Yeah.
A
Um,
third, oh, go
oh,
ahead.
go ahead. No, no, continue. Continue.
Okay, so I was going to say that's hemorrhage, preeclampsia, and then a heart failure. So the third thing that we're looking for is the body responding the way that it should following delivery, or does it seem like the heart is having a hard time doing its job? And so that can either, so initially what we find is that it manifests itself as someone's heart rate goes up really, really high, like we talked about before with hemorrhage. But then after that, what we most recently found is that once the body, I mean, it just gets tired, the heart gets tired, then the heart rate does what we would expect it to do, which is start to slow down. And that is scary, right? Because we would expect that if someone loses a lot of blood, or in the case of fluid overload before it turns into heart failure, if someone has a lot of fluids and the body just can't get rid of it, then the heart eventually gets tired of trying. And then we start to see resting heart rate go super low. So it's not back down to what their baseline was, but it's significantly lower. So we're looking for someone's heart rate to be slower and for them to really exhibit signs of just fatigue that doesn't make sense. So for this last mom recently, she walked out across the street and came back. It was 4 minutes. She was completely exhausted. Now, the interesting thing about her presentation was that normally with heart failure, we would think that the blood pressure might go down, right? So initially, the body's going to try to pump blood, but the what we're looking for typically is a decrease in blood pressure. And so it might be less than 90 over 60, which is what research says, less than 85 over 45 for hemorrhage. I want to make sure I put that in there.
Yeah.
But we're not waiting for it to get that low, right? We're looking to make sure that the person is seen and they're proactively treated, not that it's reactive and now it's a life, it could potentially be a life-threatening complication. And
Yeah.
so we're looking for, typically with heart failure, a blood pressure drop, but that's not always what we see. And so we always want to pair what we see with the symptoms, because for this particular mom, she was also having chest pain while laying on her back, right? With trying to take her blood pressure. So we typically, when we go to the doctor's office, we're sitting, taking our blood pressure. But what I asked this mom to do was take it laying down, because if your blood pressure is high and then you lay down, the expectation is that your blood pressure will probably go down, right?
Yeah.
With
Yeah.
her, not only did her blood pressure not go down, it went higher. And she had a feeling like there's an elephant sitting on her chest. So that's an automatic, let's go get this checked out, right? Automatic. And so I think a part of it too is just being in constant communication. I know as PTs, some PTs are used to just like seeing the moms in the office, and then we see them again at the next office visit.
Right.
But when you're doing remote monitoring, it doesn't have to be a PT. It's anybody who can really read data and interpret it. But for us, we have PTs, OTs, and labor and delivery nurses really doing the monitoring. And so we're reaching out just to check on them, because we can see their data every day. And
Yeah.
so if they deviate from something that is normal for them, we go ahead and reach out proactively, try to get the number back to the baseline or to a healthy status. And then that way they're not in an emergency situation. So those are the three of the things that I think rise to the surface of things that we should be on the
Wow.
lookout for, and just how we can use data. And I mean, you could take a heart rate with your fingertips, right? Someone does not have to have a wearable. The benefit that we have is that we know the person's baseline. So then we can say, okay, let's not wait to 140 over 90. For you, it's probably 128 over 78, like it was for me.
Right. Wow. Oh my gosh, this is so cool. But is there um is there a way for people to do this on their own?
Yes, 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 yes. So that's actually what we want, right? So
Yeah.
what we do is we teach people what their vital signs mean. So we start there. What is heart rate? What is blood pressure? What is
Yeah.
oxygen? What is it looking for? What is temperature? Because we didn't talk about temperature, but infection, that's another thing that we
Oh,
can pick up
sure.
on. And
Yeah.
very important, right?
Yeah.
Because it's easy. If heart rate is up and temperature is up, you might as well go and be seen by somebody. And that's again, we like people to check their resting heart rate because resting heart rate is very consistent. I know for me, it's between 50 and 55. And if it ever goes above that, I'm like, oh boy, am I getting sick? I need to quarantine, drink water, make sure I'm eating well, make sure my immune system is right, is
Yeah.
functioning
Yeah.
optimally
Right.
because it's going in the wrong direction and I haven't changed anything about my lifestyle. And so that's what we do. We teach them what are vital signs. And then why are we tracking them? What can they tell us? And then we give them summaries and we give them feedback. And so they're day to day figuring out
Yeah.
what does my body need? What am I doing when my sleep quality is really high? We tell them, reflect. What did yesterday look like? How many steps did you get in? How much water did you drink? When did you stop eating your last meal? And so they're able to see this helps. Or for one of our moms, most recently, it was a progressive muscle relaxation. It really helps with her sleep quality, but she is going for a sleep study because she continues to dip into the 70s, like for oxygen overnight. And that's not normal, right? And for the last mom where that happened, she actually had 60 apneic episodes when she had her sleep apnea test done. They gave her a BiPAP and all the, or CPAP, and all of a sudden, all of her sleep quality was like through the roof. Her body was
Yeah.
charging well. Her stress levels were down because if we can't get sleep right, nothing else is going to be right. And we even think
Yeah.
about the hormonal control. And so we teach people it's not just important to get good sleep because someone's telling you to get good sleep. It's
Yeah.
because sleep impacts everything.
Thanks.
And
Yep.
then we think about sometimes we'll have moms in it's really nice to have objective data because they may be told have 7 to 9 hours of sleep, 7 to 9 hours of sleep, and they're consistently only getting five, let's say. But then one day they're off of work for 3 days and now they're sleeping for 8, 9, 10 hours and they notice, oh my gosh, I charged it is feedback to them to
Mhm.
make better health and lifestyle decisions. Because I believe that a part of the maternal mortality crisis, part of the reason that moms are dying, is because their data is simply not tracked, because their symptoms sometimes are simply not investigated. But
Yeah.
what this does for moms is it helps them take the part of their health into their control that they can control, into their hands that they can control. And
Yeah.
so they are really waking up every day. And we always say when you open your eyes, open your app, after you pee, check your BP. And so it's just every day like clockwork, right? And so what we love to see, and this normally happens a few months into their watch wear or maybe 6 months after they deliver their baby. So like they're done only thinking about the baby and they start to really think about themselves. And what starts to happen is they say, "Don't text me. I'm going on vacation. I know my stress is going to be high. I will be drinking, and I know it. So don't even bother me." And so, but then when they come back, they text again and they say, "I'm going to recover and this is what I'm going to do." And so that those are the moments that we live for because that means that they have learned and beyond our program, they are going to be able to make data-driven health decisions for their lifetime. And to your point, not everyone will choose to use a watch, but they'll remember like I do. If I get in at least 7,000 steps a day, which means that's about a 30 to hour long walk, I have to commit to that a day. If
Yeah.
I sleep 7 to 9 hours at night, if I drink half my body weight in ounces in water, if I eliminate unnecessary stress, then that is the setup that my body needs for success, whether I have a watch or not. The
Yeah.
beautiful thing about the watch is that sometimes it will alert us that something could go wrong in terms of, let's say, getting sick. And so then we make those choices. Oh, I'm not going to go to the movies tonight. Let's
Right.
swap date night to another day this week. And so it's almost like a hint. So you notice that your stress is creeping, and it's like I didn't do anything different, so let me do something different so that I don't get sick. So
Yeah.
that's what I think the benefit is of continuing to use the watch even after you are out of the woods in terms of safety.
What is that period? When is someone out of the woods postpartum?
So I have to tell you the truth. And people always are like, it depends. You know how as PTs we say it depends.
Absolutely. Yep. Yep.
But
Great
according to
answer.
the right, but according to the CDC, it's a year. So a year post delivery is when because 33% of the deaths apparently take place during pregnancy and delivery, and then and then the largest amount takes place in the first year following delivery, believe it or not. So let's say 30% during pregnancy, 30 some odd percent during delivery, and then the rest of it postpartum. And so during up through that first postpartum year, and I believe, just in what we've seen, the other thing I want to say is, you know how we talked about the spiking of blood pressure day 3 to day 6?
Yeah.
What I'm seeing is, because we've detected it as late as day 19, is that women who have cesareans, again, it's almost like the normal fluid shift that happens after delivery will happen, and the kidneys are trying to get rid of all of that fluid and things like that. But if the swelling sticks around, then we start to see that blood pressure spike a little bit later. So I did want to make sure I said that.
Yeah.
So research says day 3 to 6. We've seen it as late as day 19. And so I think as PTs too, and I know we don't, a lot of this is not what we do, but in being in this space, it's what we learn. And it's that there are things that can be done if it caught early, right? If the blood pressure spikes are caught early. I was listening to this is a podcast, it was an educational webinar, and the cardiologists were on there just talking about the different ways to manage severe blood pressure spikes early. And that way we don't have problems down the line. And so a part of what we do too is just really educating people about the urgency of going in, not sitting at home and waiting, not I'm
Right.
going to go to bed and see what happens in the morning. It is that there are things that can be done early if we go in early, things,
Yeah.
complications that can be avoided because we've seen too many cases now where women were ignored for 12 hours and they hemorrhaged to death, or their blood pressure was ignored and they tried to go to another ER and on the way they passed away. And so
Uh,
we don't want that happening when, as PTs, we're involved in their care. And so
yeah.
we can just educate about the urgency, just going in as soon as something is wrong, even if you don't wear a watch, if something feels off, reach
Right.
out to your team because 9 times out of 10, they are going to want to help you. They're going to ask you to come in. They're going to ask you to take certain vitals. We just last night, there was a mom and her stress was much higher than normal. So just shot her a quick message and she said, my breasts have been feeling tender, but I've been back and forth to the hospital and because one of my twins is in the NICU, the other one's at home. And so turns out when we checked her temperature was also going up at 99.5. So she went ahead and reached out. Do we know that it's mastitis? No, but it's good to check, right? It just
Yeah.
doesn't
Yeah.
hurt to check. And so moms get so busy sometimes that they forget to check. But over time, because we tell them so much, hey, we're just checking on you, what's going on? Then they start to do it for themselves.
That's awesome. Oh my gosh. So
Thank
tell us more about Mommy Monitor and what caused you to start this
you.
other than your own experience, but
Yes. Well, it was really the need for more detailed information. So we use another system as well to display data. It's a data display system, but it was really the need to track trends that
Mm.
other data display systems aren't tracking yet. And so we wanted to see what's happening. What can we do averages to compare moms to themselves? Can we have notification systems that are
Mm.
more individualized because everything that's being built right now is based on standards and protocols that are out there and it makes sense, right? Because the research is getting you in the general direction of what's going on, but we need to know what's happening with us. And a lot of times, what you'll hear is, well, it's really hard to individualize everything, but it's actually not. It's not hard to individualize everything. You just have to come up with the formulas, know the percentages, and then you can really compare people to themselves. And so that was the impetus impetus for it. And of course, once it got started, it's like, okay, well, we can know more, we can find out more, we can do more. Because you think about it, if someone's resting heart rate, so with one of our moms, her resting heart rate is 49.
Right.
And so if people are like, well, if 60 to 100 is normal, then what are the norms for her? You know
Right.
what I mean? And so
Yeah.
we had to
Yeah.
figure out what are the norms for the people who don't fall under the bell curve of research, right? Who
Yeah.
they
Yeah.
seem like anomalies, and so there are no protocols for them. So we
Yeah.
wanted to make protocols for them. And that way we can say, even when other PTs, so a lot of times a PT will reach out, get their moms on our monitor, and
Uh-huh.
they'll say, okay, so we're trying to look and see what's a high stress level for them because the Garmin will tell you that 75 to 100 is high, and the 50 to 75 is medium, and the 25 to 50 is low, and then 0 to 25 is rest or parasympathetic. So as a PT, we're thinking parasympathetic activity is less than 25, sympathetic activity is above 25. But when you think about it, it's like, well, what if this person never gets to 50? What
Right.
if they never get to 40? So then theirs has to be rest is maybe 0 to 10, low is 10 to 20, right? And so
Right.
it's
Yeah.
just, we had to build something, create something that could really look at people as individuals so that they're making better health decisions for themselves. Like you said, how do we get them to do it? It's by getting them to stop looking at everybody else and just look at themselves.
Yeah.
And what that also does is it helps us to ask for help. I think as women, do you have children?
I do. My boys
Okay,
are in
okay.
their 20s. Yeah.
Yes. And so as women, it's like we're always thinking about everybody else. We're always putting
Absolutely.
ourselves
Yeah.
on the back burner. And then sometimes it's hard for us to ask for help, whether it's because we can't explain what we need. So we say, oh, it's just easier for us to do it ourselves. When I tell you these moms, they are not like that at all. They are like, I don't care how it gets done, as long as you do it and take it off my plate. It is
Yeah.
the most beautiful thing. And then we also teach their community to do the same. So some husbands, partners, are just very involved and they'll actually check their mom's app before they wake up, their spouse's app or their partner's app. And so we had a guy, he was noticing that every time his wife went to her doctor's appointment, stress was high. And it was just almost like we tried to control everything that we could control, but the distance was really far. So he surprised her with a new house that was 5 minutes from the doctor's office. And it ended up being perfect because it was also really close to where her family lived. And so they were able to have help with the older two. And when I tell you her date, she was going for a VBAC and she got it.
Oh,
She got her VBAC
good.
because they were like, whatever could stand in the way. We know the trend of stress too, and our body's ability to go back to homeostasis during pregnancy. It's a little bit harder. And so if we notice that, stress is trending higher and we can identify what that is, and partners able to step in and say, hey, I'll remove that as a stressor for you. It's so neat to just see that feedback
Oh,
in the data. And I think that's what makes the data very addictive for some moms. The
yeah.
other thing I wanted to tell you, so suicide, mental health concerns,
Yeah. Yeah.
we're
Yeah.
able to pick up on some of those things as well. And so things that you're not even thinking that you're looking for, right? But there is a pattern that most women have when they wear their watch. And so we look at their pattern, and if they deviate from that pattern, that's also a reason to reach out. So it's not necessarily that your data is off, it's that you are off, right? So we
Ah,
had a mom and she used to sync every day by 11 a.m. every day. And so we do give grace because after you deliver, you might not
yeah.
remember, right? Of course,
Yeah.
but it was day 3. So day 1, we just shot her a nice reminder text. Day 2, we gave her another nice text. Day 3, we called like, hey, what's going on? And we could hear it in her voice that
Mm,
something was wrong. And she was just like, I feel like I just want to disappear or make my baby disappear. Like she just, and it was because we love them, they trust us, we
yeah.
build rapport with them, they say things like that. And so
Yeah.
we were able to immediately connect them to an organization called Postpartum Support International. I love them.
Yeah.
And they give free therapy sessions for moms. And so typically you have to go through like an application process and things like that, but they sped up the intake and
Right.
were able to
Yeah.
take care of her. And it was just, it was a light bulb that the watch is cool. I love the watch. The
Yeah.
watch connects us though in a way that we wouldn't otherwise be connected. And that is really
Mm.
what sets it apart from traditional remote monitoring. I hear some moms and they say, oh yeah, if I don't take my blood pressure, I just keep getting this automated text that says, check your blood pressure, check your blood pressure, check your blood pressure. And nobody's asking me, why are you not checking your blood pressure? They don't call me to see what's going on. It's like they just want my data. And for us, they understand that this is a sisterhood and
Yeah.
we need your data to help you make better decisions, but we don't use your data for anything else. And so, of course, we're able to pick up on trends, we're able to see where things are going, but we're not like reminding them to take to sync or to take their blood pressure, to check their temperature because we want something from them. It's so that we can do something for them, right? And
Yeah.
help them
Yeah.
do for themselves. So I
Yeah.
think that's a really big thing to bring up too. And as PTs, of course, we intuitively get it. We love our patients, we connect with our
Yeah.
patients. But it means that much more to someone if they are being quote unquote monitored or they feel like they're being quote unquote monitored. They won't sync,
Wow.
right? Why
Yeah.
would they?
Yeah. Yeah. When do you recommend people join Mommy Monitor? Like
Yeah. So Operation
during
This is on.
pregnancy, right? And
Yeah.
yeah.
So some people, to be honest, if they've had a loss in the past and they feel like it was related to their health, they typically will hop on sooner if they
Yeah.
want to know when they get pregnant. So one cool thing about the monitor,
Oh,
is that right? So you
yeah.
think about it, it's like, oh, my stress is higher for no good reason. My resting
Yeah.
heart rate is higher for no good reason. Ends up being really good reason. One time I went to see a mom. It was so awesome. She took a pregnancy test and she thought she wasn't pregnant and she was like, I know I'm not pregnant. And I said, no, you're pregnant. And she was like, I'm not. I took the test. And so I it was really beautiful because I went to her house and just pulled up the computer. We were on the way anyway, and showed her what was going on. And I said, so maybe in a couple of days you might see it. Not
Yeah.
sure because it's not like our we just detect
Yeah.
pregnancies all the time.
Right.
But I said, but you didn't do anything different. Your steps are about the same. You slept for about the same period of time. Your resting
Yeah.
heart rate is creeping up. And so about 2 days later, she messages me and she's like, I'm pregnant, I'm pregnant, pregnant. And so some people
I
get on
love it.
because they want to detect as soon as possible, especially if they've had a loss. And so we've
Yeah.
had moms, you know how sometimes people are told, well, you need to wait 6 weeks, you need to wait for your appointment. What we've been able to do is tell people super early, and then they're able to choose the provider that will take them in early. It gives them a sense of, is this person going to be there
Yeah.
when I need them, when I need a peace of mind?
Right.
And so it really helps with that. The other thing that we've noticed, and this is interesting, is that sometimes when someone gets pregnant, let's say with IVF, or they're trying to get pregnant with IVF,
Yeah.
we typically see an increase in stress, like you would if they
Oh,
were getting
sure.
pregnant without.
Yeah.
So if we don't see that increase in stress, sometimes that has been because their progesterone levels are low. And so we learned that with them. And so
Oh,
we've also now been able to help people who have had miscarriages and things like that, but they're not pregnant with IVF. It's just we're not seeing that stress
yeah.
increase that we would expect. And so they go back, they get their progesterone levels checked, they get progesterone, given to them, and they have a great pregnancy. And so
So awesome.
it's really the combo of data change and questioning, like why is this happening? Because
Yeah.
the watches are not built for pregnancy. They're not built to diagnose or treat or
Yeah.
anything
Yeah.
like that. It is that our numbers tell a story. And
Mhm.
so if we don't notice a pattern that we're used to seeing, then we reach out and see, is something off. We had a mom where we caught thyroid dysfunction. She was 9 months postpartum and she was at work and she's a pharmacist. So like she sits at work mainly, unless she's going back and forth to get medications, but her heart rate was up and it was like 3 hours. So initially we reached out and we're like, hey, are you exercising? Did you take off today? Just
Yeah.
what's going on? And she was like, no, but I've been hot. Like I've been really, really hot. And one of my coworkers told me that it was probably perimenopause. And I was like, or it could be postpartum thyroiditis. So you know what I mean? We don't know what it is, and
Yeah.
we shouldn't assume that it's
Right.
perimenopause. And so she went in and asked to specifically see and to get her thyroid levels checked, and then if possible, go see an endocrinologist. And that's what ended up happening. That was the pattern of which, and it was just heart rate increased.
So cool. So,
Thank
so
you.
cool. I always teach, Catherine, that the body tells a story.
Oh my gosh, yeah.
And you're like, the numbers tell a
Fun.
story. The numbers are telling the story of the body.
Of the body, 100%, right? And numbers don't lie.
Right. Well,
They,
the body
we,
can't lie.
the
The
body
body can't
cannot lie.
lie.
Amen. Oh,
Yeah.
I love that.
Yeah. No, it's being held in the tissues, right? It's the heart response. It's everything.
Yes.
Yeah. So I love this. Oh my
Yes. And can you
goodness.
imagine the increased trust now that women have in their bodies, in
Yeah.
themselves?
Well,
They refuse to be ignored. I promise you.
I
They are like, if you
oh,
don't listen, I'm going to six other
someone
people
else. Yes.
until they do.
Oh, I love it. No more gaslighting, right?
That's
No
right.
more gaslighting. Damn it.
That's right.
Woo. Well, and what I also appreciate about this is helping, like the numbers can help the moms tune in to what they're actually feeling in their body,
Yes.
right?
Yes.
Like
Yes.
making that connection, which is so huge.
Oh, it's so validating too. When someone
Yes.
wakes up and says, I am just exhausted, and then they
Yeah.
see that they're at a five, they're like, oh, I
Yeah.
have a reason to be like, it's almost like you didn't need validation. If you're exhausted, go to sleep, right? If you're
Yes.
exhausted, work from home. If you're
Yes.
exhausted, ask for help. But the numbers help them
Yeah.
feel better about doing it.
Yeah. Yeah. There. Oh my
And
goodness.
then on the other hand, championing their great lifestyle choices when they choose to drink more water and they notice their stress goes down and their blood pressure improves. We
Yeah.
had a mom, she came off her blood pressure medication. When we first met her, it was an interesting presentation, and it's only happened twice that we've in the monitoring that we've been doing. But her blood pressure at the top was low and at the bottom was high.
Okay.
And she was
Wait,
like,
wait, top and low. Are you
oh,
talking
systolic
systolic?
and diastolic.
Yeah,
Yeah,
thank you.
yes,
Okay,
ma'am.
want to
So
clarify.
let's say 110 over 90.
Okay,
And it's
yeah,
constantly that weird combination.
yeah, yeah, yeah,
And it was just at day three, I said, well, how long have you been, having this issue? And she said, well, it's been quite some time. I had preeclampsia with my first, and, she had gotten taken off of medication. She had never been put on medication, I don't think, but that ended up being her pattern. And so she was just told, exercise and eat right. That was the general advice, yes, that was given. So she's on the treadmill every day for like an hour. And then she was eating well. And I think her diet was pretty good, just based off of what she told me. But we're not experts. So
yeah,
if someone needs extra, if we're just kind of looking and seeing, oh, you're eating out a lot. So we tell our moms avoid fast, frozen, and packaged foods. If you do that, then you're really on a good path. And
right,
eat veggies with every meal. Don't just think of it as something that you do, just general advice. But plenty of times we've had to refer people to dietitians, nutritionists, just so that they can really get into the weeds about what's going on. But
yeah,
for her, she said it sounded her like her diet was pretty good. Um, and so anyway, I asked her, I said, instead of doing the treadmill for an hour, could you try circuit training? So maybe just where you're doing a little bit and then backing off, doing a little bit. So we did 3 minutes, 2 minutes of running, 3 minutes of walking, 2 minutes of running, 3 minutes of walk.
yeah,
So we tried that and her numbers looked better. And I said, have you seen a cardiologist before? And she was like, no, never been to a cardiologist. And I always recommend if someone has had preeclampsia or they run into hemorrhage or they have any issue with their kidneys or anything that could potentially impact their heart, it doesn't hurt to just go see a cardiologist. And
yeah,
so just ask. And typically the answer is sure. I mean, it's not on your doctor's radar necessarily. But if you ask, then the answer is typically yes. And so she goes and sees a cardiologist. Turns out that she had a mitral valve regurgitation. And so it made perfect sense why her diastolic would be high and her top number would be low. And so it was like, now that it makes sense, what do we do? He was like, it looks like you've already figured it out. Change your exercise pattern, nothing for me to do. And so that she's
oh,
had her blood pressure's been fine ever since. And so it's just thinking about people who come to us, they're given general advice. We are able to give them targeted advice. And
yeah,
so never again, when I tell you, when we started doing the wearables back in 2014, when moms were like, well, how often are you going to come and see me? And I'm like, I'll let you know based on your data. I mean, it's
yeah,
like if it's not going to be Monday, Wednesday, Friday. It's going to be, are you recharged on Wednesday from our Monday session? And if you're
yeah,
not, then maybe we'll try Thursday or Friday. But it's like, and then also as a PT, it's a reflection. Well, was that too much? After she worked out with you, her stress was still elevated for 2 hours. And so maybe we back off of the intensity because she's not responding in the way that you would expect that she responded. And I had to do that with myself after even though my kidneys healed eventually,
Yeah.
it was okay, now I'm getting back to exercise and I'm running for 30 minutes and my body is stressed for the next 7 hours. It's too
Uh,
much. And so let me try and see how do I back off of this and then get to where my body's coming back down blood pressure wise and stress wise within a reasonable period of time. And once you look at like the World Health Organization and they say, your blood pressure after activity should drop back down but within 6 or 7 minutes, right? So you sit down 5 minutes, you retake. But they also say, well, wait 30 minutes till after you exercise to retake and after you eat and after you drink alcohol.
yeah.
So like there is some period of time that you should expect that your blood pressure will return to normal, that your stress will return to normal.
Yeah.
But the question is, are there days when your stress returns to normal really quickly and you've gotten in a good workout? What did that workout look like? So we
Yeah.
reflect on those things so that we're not in a state of fight or flight for a long period of time if we don't have to be.
Yeah.
So I think as PTs, it's exciting because
Yeah.
it helps us to really just be even more specific about how we treat and love
Yeah.
the people who come to us.
Okay, so my question about when should we start
Oh,
monitoring? You
I'm
were saying
sorry.
earlier, no, I just like, so early
Yes.
on, if we've had a loss or something, but say someone's healthy, first pregnancy, when
Yeah.
would you want someone to join the program?
So we like at least before 20 weeks.
Okay.
And the reason is that at 20 weeks, our heart will start to work 50% harder, kidneys start to work 50%, right? It's like when we start moving to that shift of our body is going to start working harder. So it's nice to know what was it pre 20 weeks and then what does it shift to after 20 weeks. The other thing that we've noticed is when people come on between 30, so between 20 and 30 weeks, it's a toss up. I'll say that in terms of
Okay.
like people's willingness to advocate for themselves. After 30 weeks, if they've already been told, hey, you're going to have a C-section, you're probably going to have to induce your labor and stuff like that. They've
Yeah.
pretty much already said, okay, I'll just do that. And we're pretty much monitoring so that if anything goes wrong, we're able to help them catch it, to really recover well. If you hemorrhage, or let's say you go from, this happened with one of my moms, she went from a 12 to an 8 because she's
12
still
to
above
8 of
a
what?
hemoglobin. Sorry,
Got it?
hemoglobin. I'm so happy you said that. You
Yeah.
asked that. So 12 to 8 hemoglobin. Because she wasn't under 7, she wasn't transfused. Because it's like their absolute cutoff is under a 7 in a lot of hospital systems. And I know it was that way where I worked. And so even though she's operating with a lot less blood available, oxygen available to her, she wasn't given a boost. Right.
Mm.
And so in that case, we're watching really, really closely. That was another time when we caught fluid overload. This mom just could not, her heart rate was 160 making a baby bottle. Yeah. So it was like we're not trending in the right direction. And she ended up going back in. She went for an EKG. She got transferred to the hospital because she went to the med stop for that. It was close by. Got transferred to the hospital. Cardiologist put her on some medication to help her heart slow down. And then she went back home. And so it was quick, but he told her if you had been stayed home for 2 weeks, you would not have made it. Not with the amount of work that your
Oh,
heart, right? And so when you say when to come on, it's like, so if someone comes on, let's say postpartum, they haven't really gotten into the habit of advocating for themselves. They don't really know their body that well. But we
yeah.
can still, then it becomes more incumbent on the monitor that is assigned to them to reach out and make sure that they're good. When you come on but when you come on right at 20 weeks or right before 20 weeks, it's like you get that practice
Yeah.
asking, advocating. You get to see how am I doing? If someone says your body's really tired, you need to go ahead and have an induction. You can look and say, actually, here are my monthly summaries. And this is what a lot of our moms have done. Here are our monthly summaries. I'm feeling pretty good. I'm looking pretty good. Is it okay if I just stay
Yeah.
pregnant? Like, I don't want to be induced if I'm actually doing okay. And so we have half of our pregnancies that we've monitored, they have declined in induction because they're healthy and they're able to prove that they're healthy, right? Because sometimes I try to explain to people, not every doctor wants to intervene, but if they see your stress going up, your blood pressure going up, your heart rate going up, your everything, your resting heart rate is 105, they want to get this baby out,
Yeah.
right? And
Yeah.
so we have to put ourselves in good position to make really good health decisions so that when we show up to the end of pregnancy, we are ready for the marathon of delivery. Because I tell
Yeah.
them we're going from one marathon to another marathon,
Another.
and then
Yeah.
postpartum is another marathon. And so I think 20 weeks is ideal if they could come on a little bit before 20 weeks.
Okay, great. So tell us, how do we as practitioners get someone hooked up to Mommy Monitor, get them involved with you guys?
Yeah, so we have an interest form on our website. Of course, PTs and OTs, all the other midwives, whatever, they just text me and they're like, "Hey, we have someone who's going to reach out to you." There's an OBGYN here who just loves us, and she always will shoot me a text and she's like, you'll be hearing from such and such today." Primary care doctors, they refer to us. Mental health therapists are our biggest, like a big referral source as well. And so I make it easy for them. But and then in terms of the mom, of course, then we end up just reaching out to her, setting up a time for us to chat. We do an hour long consultation, excuse me, just to make sure that it's a good fit. There
Yeah.
are some people that I don't think it's a good fit for. If someone's really high anxiety, we've noticed there are two
Uh,
people that over the last 4 years just weren't a good, it just wasn't a good fit. And
oh,
the biggest thing was they would rather, and this is just a personal decision, but this is the way that they described it, they would rather run into an issue
oh,
than to feel like they're constantly like worried about an issue occurring, if that makes sense. So it's
yeah.
like high anxiety profile may not work. The cool thing is with these watches is that you can turn off alerts. We can make it to where we only reach out if something is actually going on. But at the end of the day, for some people, it's just not a good fit.
Yeah.
And so we do talk to everyone for at least an hour, make sure they're a good fit. And then one thing just as PTs that I think we should all do is have moms check their prenatal vitamins. My prenatal, I didn't talk to you about this, but my prenatal didn't have iron, and I didn't know that gummies don't contain iron, or they're not able to hold iron, and it's not on the bottle. So it talks about folic acid and DHA and all the other things,
Yeah.
but it doesn't say anything about lacking iron. And so for me, my hemoglobin was low, but they didn't know until week 28. And that also made me start thinking, why do you check hemoglobin at week 12 and week 28? I'm sure there is some basis for it, but a lot happens between weeks 12 and week 28. And what we have found with anemia, when we've detected it, is that heart rate is typically a tad higher, and then body battery just doesn't charge. And so mom may not say she's tired or, feeling fatigued, but we notice that nothing she does helps her charge. And then when she goes in, her hemoglobin is lower. The cool thing is that she's not waiting until week 28 to ask for another hemoglobin check, right? And so the research shows there's a little bit of research about it, but shows that anemia in the first trimester is linked to preeclampsia in the third. And so it made sense to me why I went into preeclampsia. I had no other risk factors. And
Oh,
that anemia wasn't caught until week 28. And so and then, of course, I was like, well, let me try to do it naturally. So I'm going to eat more iron. I'm going to do
yeah.
this. I'm going to do that.
Yeah.
And I never checked my prenatals. I didn't know. But she told me, she said, if you're not above 11, you won't be able to have a home birth. So I paid someone, and this is we direct primary care doctors are the best, I promise you. I paid someone to recheck my labs before I saw my midwife because I was like, I need to know, are my numbers trending in the right direction? And so I
Yeah.
just paid and they checked it for me. And the lady said, your numbers are, but they're moving slower than we would expect with you being on and having iron, and taking it every day. She said, so please continue to take your prenatals with iron. And I was like, in my head, I was like, why would anybody make prenatals without iron? So I checked mine, and that's how I found out. So it wasn't until like week 32 that I actually was on. Do you know what I'm saying?
Wow.
So now,
Yes.
everyone who's pregnant, I ask them, are you on a prenatal with iron? Are you on a prenatal with iron? Because as PTs, what we hear when moms would come to me before I started doing all of this was, I don't take my iron pills because they make me constipated.
Yes. Yeah.
Oh, we can fix constipation. Let's increase your fiber. Let's increase the amount that you're
Yeah.
moving. Let's hydrate better. Let's do massage.
Yeah.
Let's think about what can we do to address the constipation, not come off of the thing that you're going to need the most during your
Right.
pregnancy.
Yeah. Oh my goodness, this is crazy. And what comes to mind as you're saying that is the vitamin D. There's not enough vitamin D level in prenatals, that you need to be taking more. And
Yeah.
I have lots of podcasts, and we've talked about it in summits a couple of times about the importance of vitamin D.
Yes.
So please, and Everybody says check with your doctor, but Grassroots Health has done, and we had Dr. Bruce Hollis on and he was like 5,000 during pregnancy, 6,000 for breastfeeding. And so, like that's the numbers that they promote. Yet, you should check with your provider, have your clients check with your providers, but that is the minimum for
Wow.
that. So, yes, all these major supplementations that are not in prenatals, like,
Yeah.
yes, that's so important to make sure we're asking our clients about what prenatals and what's in their prenatals and all
Yeah.
that stuff. Dr. Bill Chen on Instagram just had yeah, he's great. He just had a post on the prenatals and how it's missing some of the most important aspects of supplements in there.
Yes,
So, yeah,
yes. Our biggest role is education. And that's what I always say,
yeah,
because we can educate, we can connect people to the resources, even the ones that I know we're talking a lot about providers who could be helpful. But when I initially got started, there was this woman whose sleep quality was only good when she was at her mom's house. But
oh,
when she slept at her boyfriend's house, it was terrible. And so I was like, "Where do you sleep at his house?" And she FaceTimed me and like showed me the mattress, and I was like, "Oh Lord, Lord help us! You need to stay at your mom's for a while until y'all can get a better mattress."
yeah,
And I started to think, as a PT, when people ran into needs, I would just pay for it. It's like, "Oh, they need that, I'll buy that for them." But when you have an organization like this, and social determinant of health needs arise all the time, you can't
yeah,
pay for everything. So we actually partner with nonprofit organizations who help us with diapers, wipes, food. So if someone's blood pressure is high, but they can only fit stuff in their lap because they're dependent on transportation on a bus, and they say you
yeah,
can only get what. So then, of course, you're going to buy cereal, milk, bread, right? Right. You're
yeah,
not buying things that are going to not last until you
yeah,
can get back to the grocery store. So mobile markets, we partner with people who help with transportation, housing, safe housing. So sometimes
yeah,
as PTs will say, "Oh, can you just get out and do a nice walk?" And if the person doesn't know you, they're like, "Sure." But if they know you, they'll say, "The person in the apartment next to me got shot last week. I'm really afraid going outside." And so now we're able to connect them with someone who gets them into safer housing. And so then they can move. Because if we think about movement and the importance of it, right? It's
yeah,
so important to move. It's important to move well, to move appropriately, because sometimes what we find is that, okay, research may say 7 to 11,000 steps, right? Under 4,000 steps is all cause mortality is associated with it. However, this person has been diagnosed with preeclampsia. So how much can they move and it still be
yeah,
safe? And so that person may be at 1,500 steps for a couple of weeks, but we know that it's a temporary adjustment. On the other hand, if someone is only staying in their one bedroom apartment with their four kids, that's number one, a mental health. Like we're thinking something
right,
might occur. You're a single mom, four kids, right? You have no place to just take a little bit of a break. And
right.
then the only activity you're getting is inside of your home. We have to fix that. So we can get you who doesn't have a physical limitation to 7 to 11,000 steps a day.
Yeah.
Yeah.
Yeah. Oh my gosh. How do you guys work with payment and what does that all entail for your clients doing
Yeah. So
monitor?
it is a couple of things.
Okay.
So, for people that we know would not be able to afford it, we always are partnering with organizations that write grants. And
Okay.
so they write grants and then they're able to pay for the moms who are in specific areas. We specifically been contracted for people who have low birth weight risk.
Mm.
So areas like that, rural areas, and then teen moms. And so
Okay.
typically we partner with people for those. And then for people who just want to be monitored, who we know could afford it. So their healthcare providers are a big part of the people that we monitor,
Yeah.
and the people that they refer. They pay cash, and it's two sorry, it's 300 for the first month. So it's the watch plus the monitoring, and
Okay.
then 150 for every month thereafter.
Okay.
And they just pay that, and it's like on a subscription, very easy. Sign up for
Yeah.
PayPal, it just continues to pull, but there are no contracts. And I like people to know that we only want you to stay with us if you want to be with us. So
Right.
there is not a contract, it's month to month. After 6 months postpartum, it goes down to 100 a month, and then it just stays there as long as people want to continue to be monitored.
Got it.
We'll
Okay.
make it work.
Oh. That is
Yeah.
awesome. Katherine, this is incredible. It's just so eye-opening of what we can do. Oh, I know another question was popping in. Why did you move from the Fitbit to the Garmin?
So the Garmin, it was really the body battery. I just
Oh,
like the
okay.
body battery function. The Fitbit is great for what it was great for. For
Yeah.
people to have that constant feedback throughout the day for body battery, I feel like that's the biggest differentiator.
Yeah. Okay. And do you know about a lot of people have the Apple Watch. So does that have similar
So
uh
functionality,
functionalities? Yeah, thank
with,
you.
yeah, in terms of our technology, we're not doing the Apple right now. The
Okay.
biggest limitation we've seen with it is the charge. So people will try to charge their Apple Watch overnight
Oh,
and we need sleep data. And
got it.
and people they've worn both. They're like, I just love
Oh,
my Apple, so I'm just gonna
yeah.
put one on one
Yeah.
hand, one on the other. But that's why the
Okay.
battery life is not the same.
Got it. Okay. Interesting. Oh my goodness. I know
Yeah, thanks.
this is probably a really long podcast episode, everybody, but I just think it's so important that we get this information out there. As soon as I heard about it, I'm like, oh, I want my audience to know about this because I think more PTs need to be referring moms and are there I'm sure the answer to this is it depends, but I mean, what are you finding with your results of like the people who are having issues showing up for them? What percentage of your population are you having to interfere or help support better?
This is such a good question. So we've had support better. I would tell you of the 178 mommies that we've had so far,
Okay. Uh-huh.
we caught 64 major complications between office visits. But the cool thing is that because of response time,
Yeah.
they have not had negative outcomes. And so that's one thing, negative outcomes in terms of like complications
Yeah.
going missed. Um, in terms of the additional support, I mean, it's everybody in terms of like learning more about their bodies. Is that what you're
Yeah.
asking? And just
No,
making,
no, no. You just answered it right
oh,
there. The ones needing additional support, needing the medical intervention,
yes, yes.
right? But everybody that goes into this program is getting educated about their own body,
Yeah.
which is priceless, you know?
Yeah. Yeah.
So yeah, I really think that I really hope for you that Catherine, this takes off and explodes for you guys because it's needed and it's necessary and yeah, so thank you
Of
for
course, you're
being on this
welcome.
podcast and sharing this and for doing what you're doing. It's incredible.
Well, thank you. And like I said, if Perry hadn't sent me the watch, I love her so much. And she really helped me because data can be scary
Yeah,
when you're going through it. And as a PT, knowing how to control your body, like we know if something
yeah.
is off, we know how to control it. So to
Mhm.
be out of control of it, but to have someone like her, when that wasn't why she was monitoring me, but she would see it, my data, and she would say, Catherine, are you okay? Are you relaxing today?
Yeah,
Or I would take my blood pressure and it was higher than I wanted it to be. And she would say, don't worry about it. Just check your data, just check your blood pressure like you're brushing your teeth. It's just, you got to do it. It's giving you good information, and then you just keep
yeah,
going. And it made the difference. And I decided I'm going to make that difference for other people. And just
yeah,
lock arms with people who want to do the
yeah,
same thing. Because while data does give you information, it can also scare you. And if you don't have someone to say, it's okay, there's a
yeah,
solution for that, there's
yeah,
a medication for that, it won't last always, and to
yeah.
cheer you on when your data improves. She changed my life,
Oh.
saved my life, along
Well,
with the midwife who looked at my individual data. And
yeah.
so I will
Well,
do this forever for other people.
yeah. Oh, you're making me tear up too because I love this because you've also helped. Like, how many of the clients that you've had have you saved as well? So thank you for the work that you're doing. And I'm very honored to put this out there and to my audience and share this with you, with them, so that we can get the word out about this because this is huge and I hope it explodes. I was just thinking for myself and for my clients, I'm like, do you have any cards or, postcards or, like, can you send those to me? Because I want them
Yes,
on my table
please.
so that, and where can people learn more about you? And for practitioners, where can we get information so that we can help our clients find out more about you?
I'm so happy you asked that. So I send flyers to different providers who ask and they put them up in
Right.
their offices. So thank you for that.
Perfect. I want
They
one.
can. Yes, thank you.
Yeah.
On Instagram, I'm at Operation Mist. On LinkedIn,
Okay.
Katherine Sylvester, that's my name. But I always will ship whatever is needed or wanted. And my
Yeah.
email is info@operationmist.org. But
What
our
does that
website is, oh, did you
what does
say what
this
is
stand for?
Operation Mist?
Yeah.
Monitor, Intervene, Survive, Thrive. So that's the name of the company. Mommy Monitor is more the program. So
Oh my gosh. I love it. That is
thank you
so
so much.
cool.
So
So
yeah.
cool, you guys. So please, everybody listening in, check out Operation Mist, mommymonitor.com. We'll have it all in the show notes. You can check it out and learn more. And please, let's share this with pregnant clients and get them supported and helping them to learn more about their body and the reactions. And let's help save some lives, everybody. That's what this is really all about. So, thank you, thank you, thank you, Catherine. So appreciate your time and sharing your knowledge with us and for everything that you're doing in the world. Keep it up. Keep it
Thank
up.
you so much for having me. I'm
Yeah.
honored.
You're so welcome. All right, everybody. Thanks so much for listening into this episode. And let's keep more moms safe and healthy throughout pregnancy, throughout that postpartum period, and help them know more about Mommy Monitor. All right. Take care, everybody. Here's to smoother births, happy, faster recoveries, and healthier moms. Take care, everybody. Bye bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.